Before we begin proceedings, I would like to acknowledge the traditional owners of the land on which we meet and their ancestors past and present and emerging, the Cabrogal clan of Darug Nation and Gadigal people of the Eora Nation. Good evening, everyone. This is Gizem Berro. I'm the youth worker at Western Sydney MRC. Thank you, all the attendees via Zoom and via Facebook. I would like to advise that this session is recorded and live streamed on Facebook, as I mentioned before. This session is organized as part of the vaccination campaign by the Iraqi Australasian Medical Association, IAMA, and Arab Council Australia. And tonight's session is supported by Western Sydney MRC. On behalf of Western Sydney MRC, I would love to welcome you all. As I said, a little bit like housekeeping tips. If you are following us from Zoom, you can put your questions on the questions in the chat box during the Q&A session. And as I said, please feel to insert your comments through the chat box. If you're unable to use all these options, please raise your hand option. Use that option and we will allow you to talk. If you're following us from Facebook, please write down your comment box. So yeah, I will hand to the following.
Thank you, Gizem. Good evening, dear friends, colleagues, and respected community members. I'm Wafa Jiha, medical scientist and quality manager in New South Wales Health Pathology. Thank you all for giving your time to be with us today in this informative session. First, I would like to acknowledge the traditional owners of the land and pay respect to elders past, present, and emerging. I would also like to thank Western Sydney MRC for their great support and efforts in hosting this event. Thanks to the CEO, Mr. Kamal Debussy, my dear Anne-Marie, acting CEO, Nadia, Rachel, and colleagues for your consistent effort. By the end of tonight, we would have marked 58 days since the latest Sydney outbreak on 16th of June, and 18 months since the WHO has declared COVID-19 as pandemic in March 2020. The infection rates with COVID-19 in New South Wales and other states in Australia have been on a dramatic rise, with the Delta variant showing to be more infectious, transmissible, and deadly. The residents of New South Wales are living in hard lockdown situations across many local government areas. As a consequence of this lockdown, we have seen a negative impact on the economy, well-being of those we know and love, and our overall quality of life. Many members of our communities have been postponed, others have lost loved ones who could not pass on a final goodbye due to the funeral restrictions. A son who lost his father from COVID-19 infection said, "For a man who embraced life and loved his very large family to have his life diminished and pass in such a small way, alone in a small room, I don't think any one of us deserves that." These words broke my heart. Another member said, "On Tuesday, I lost my mother from COVID-19. And on Friday, I lost my father, and we could only see the funeral from the window passing our house. As migrants, we came to this beautiful country to live with dignity and die with dignity. Children and grandparents have not been able to connect for months, while school children are deprived from practicing their regular sports and socialize with peers. Another potential deterioration on the mental health of these children, and the list goes on. However, there is hope, and a bright future is coming to our beloved Sydney and Australia. Our fate is in our hands and hope is on our side. We can change this faster than we can imagine. Vaccination is our only savior from this dark situation. It's the only way you can protect your mother, your father, your auntie, your grandparents, and your loved ones. The last few weeks, the vaccination rates have improved dramatically with the goodwill and determination of our citizens and our community members. As part of our duty of care, the Iraqi Australasian Medical Association and the Arab Council Australia took the initiative in May 2021 to launch the Corona vaccination campaign to raise awareness and provide scientific evidence about the vaccine. We are here tonight with our medical and professional experts to answer all of your questions regarding the vaccine, the rates and the benefits of vaccination, and more about the latest Delta variant outbreak. Joining us tonight, our respected speakers, Associate Professor Ahmad Alrubaie, a Senior Consultant Gastroenterologist, Therapeutic Endoscopist, Bariatric Endoscopist from the University of New South Wales, the Faculty of Medicine. Also, we have Dr. Emad Berro, Pathologist and Microbiologist. Then we have Joshua Karas, Executive Manager at United Nations Association of Australia and New South Wales, Greater Sydney Commission Youth Board Member at the Department of Premier and Cabinet, New South Wales. Will be joining us also Dr. Zainab Riza, a Senior Advanced Trainee in Hematology at Liverpool Hospital. I would welcome all our speakers and welcome to Dr. Alrubaie.
Thanks, Wafa, to your acknowledgement. And I would like to start by passing my great thanks to the Western Sydney Margaret Stewart Centre and its CEO, Mr. Dabusi, with a special thanks to Nadia Bushti for the great effort she's putting to have this webinar happening. And I extend this thanks to Rachel Haywood. I would be grateful if you allow me to share.
Doctor, you can share, just share screen and then you will be able to.
Okay, just, okay.
The icon right in the middle, yes, perfect.
Yes. Okay. Let me just go back to the beginning. Now, okay. In a recent debate with one of the anti-vax camp on the SBS Arabic, he started his discussion with a talk about how this virus was produced in a lab in Wuhan in China, with the donation of Bill Gates and the American companies there. So I would start with this, because this is up until now, in spite of all these 18 months of the drama, there are still some talk about the origin of the virus. Now, coronavirus is not a new virus. It is a well-classified, recognized virus within a group of viruses of 4 families with many subgenera and species. Out of all, there are 6 and now 7 so far, which attack human beings. 4 out of these 6 cause the common cold in people who are immunocompetent. And the other 2 were the causes of another pandemic in 2002, which we call it SARS-CoV-1, transmitted through bats. And the second one is the cause of MERS epidemic, which was transmitted through camel, and the Middle East was the field for it. And our SARS-CoV-2 is the 7th one. So it is not a new virus and not a virus established by human beings. Now, when we start our education to the community and our clinicians and general practitioners last year, particularly in March, April, May, we were talking about the spectrum of symptoms or of the disease itself, the COVID-19 disease. And we were talking about this rate of each of this spectrum. So we know that more than 80%, probably 81%, were either asymptomatic or having a mild disease. And there is about 14% with a moderate disease, which might need a straightforward medical treatment, mostly out hospital and sometimes in hospital for the antibiotics, etc. And there are around 5% of this spectrum with the severe illness, severe disease, which require the admission to intensive care. Among them, among this percentage, the casualties, the death are there. Now, this picture changed since the eruption of the corona variants from the last third of last year. Just to explain what variants are. Now, part of the natural behavior and history of all viruses, not only corona, is that when they attack a cell, they hijack that cells and they integrate themselves with the genetic machine with one order to start replicating the virus itself instead of replicating other proteins useful for the cell, for the human cell. And during this process of rapid replication using the cell, the human cell, it happens that, like any production in life, there are some damaged or abnormal copies. And the buildup of those copies with time and with the development of a strain which has some characteristics and abilities make it different to the original copy or original strain. So this is the variant in simple words. And up until now, there are 11 variants. 5 of them were of concerns. And in fact, there are 4 of them of concern. They are the dangerous one. The first one is the Alpha variant, which appeared in UK. The second one is the Beta variant, which appeared in South Africa. And the third one is the Gamma variant, which appeared in Brazil. And the fourth one, and the most dangerous one, is the Delta one, which appeared in India. Now, I added Lambda, in fact, from the list of variant of interest, the list of variant of concern, because particularly lately, it appears that this is probably the most, would be, if it's spread, would be the most dangerous strain. Now, the other 6 are of interest because of the peculiarity of their mutation, but they are not of major concern. One notice here, you notice that these variants appear in the countries of areas with the highest rate of COVID-19. And this is the requirement for the development of the variant. So a few cases are not enough to develop a bad variant. Maybe sometimes it ends with a mutation which killed the virus if there are only few cases. But against the resistance of the large number, these develop. Now, everyone now is interested with the Delta variant because the Delta variant now is the dominant variant in all Europe. And up until last week, it is responsible for 82% of cases of COVID in the United States. And our current wave of COVID-19 or coronavirus is virtually a Delta variant related. Now, this variant has 3 mutations. And with all these mutations, they are centered around the C protein and also the binding with the ACE2 receptors on the cell. And as a part of the impact of this mutation, the virus is highly transmissible with 50 to 60% higher transmissibility compared with the current one or with the original corona. Now, what does this mean? First of all, it is estimated that the viral load in Delta variant is 10,000 higher than the viral load in the initial strain. 1,000 times more than the original one. That's one issue. And obviously the infectivity of any virus depend on the viral load. The higher viral load, then the wider and the stronger ability to be transmitted to other persons. Now, there is a longer shedding duration. This variant stay in the body up to 19 or 18 days versus around 12 days in the original strain. The second dangerous characteristic of the behavior of this variant is that it is much higher in terms of the cases or the number of severe cases. Studies from Canada and Singapore and Scotland estimated that the rate of hospitalization and intensive care admission is at least double the rate of alpha variant, which is by itself is a variant, which is more dangerous than the original strain that we talk about. Now, in terms of the clinical spectrum, also it can have a milder case. And in the presentation, there are some differences. So while all of us knows about the fever, the myalgia, the arthralgia, the loss of the smell or loss of taste, here we are dealing with a picture of a bad cold, a bad common cold with headache, sore throat, and runny nose dominating the initial presentation. So even in the presentation, it is different. Now, it can cause serious symptoms, which are related to the shortness of breath, the high temperature fever, chest pain, some neurological features like loss of speech or movement, confusion, cyanosis, etc. Now, I will stop a bit here on the differences in terms of the presentation. We know that the original version, the original strain, was mainly a respiratory disease, which attacked the lungs, and we end with all the respiratory distress syndrome there. And this expands to include other organs, obviously. Here, in addition to the involvement of respiratory system with chest pain or shortness of breath, ending with respiratory failure, there is a significant difference in terms of the severe neurological complications like fits, seizures, stroke, brain infection, nerve damage, and delirium. The other peculiar presentation is the cardiac involvement. The cardiac involvement in terms of the inflammation of the cardiac muscle or the cover of the heart, the pericardium. And I will mention here just a recent study to relate it to our youth. In a recent study involving 14,000 between the age of 12 and 17, this is the rate. You can see it is a significant rate, 450 in a million for young males and 213 per million in young females. So these are some features which make it more dangerous and risky, even at the level of young people. Now, the age spectrum, the Delta broken all the rules we know about Corona. We were very relaxed when it comes to kids or young people. And we thought that Corona is mainly a disease of elderly in terms of the severity, the mortality rate, etc. But Delta broke this rule. And now we are dealing with not only increasing, but a major shift toward ages between 20 and 49. And you can see from this graph that even kids between 0 and 9 years, they can have it significantly compared with people above the age of 60. So this make this more risky, this waves with the Delta more risky because it's across the age. Now, the latest from the CDC, the Center for Disease Control and Prevention, mentioned that ages between 18 and 49 are the largest demographic hospitalized COVID patient since July, even in the state, because it started to dominate. Delta started to dominate virtually the last few months. So since July, this is the dominating age group. Now, what's even worse, that Delta has a Delta plus variant with an extra mutation. This one you can see, which is the K41.7N, which is also presented or found in other variants, the beta and gamma. This additional mutation make the virus even more contagious, causing more severe cases, and not only that, more resistant to vaccine, our immune system, and even to the medications, to COVID-19 medication in serious cases. Now, I'll stop here at Lambda. Lambda is another variant. It appeared in Peru late 2020, and it has 7 mutations. Now, the more the mutation, the more difficult to have a vaccine which cover all of them, right? And that's why this is of a concern to have this spread. And lately I heard there are a few cases in Japan. There are a few cases reported in Japan, probably during the Olympics. So we have 7 mutations, which cause definitely increase in the infectivity, a drop in the effectiveness of vaccination, and the higher rate of severe cases. Now, the mortality rate in Peru was 9.2, which is much higher than the standard mortality rate. Now, we started with this mortality rate in Wuhan, which is 2%. Now, over the last 18 months, all our efforts as United Nations, WHO, government, universities, name it all, were focused on 2 lines of treatment to stop or control the pandemic. The first line is the border closure and the lockdown, which we are having one of the worst type of it here in Sydney. And the second line is the treatment of high or severe cases or advanced cases of COVID. Now that's the focus with all the effort, with all the investment. Let us see what we end after all this lockdowns and border closure, etc. Let us see where we end. The current daily rate of cases worldwide range anything between 400,000 and 700,000, depending on the fluctuation. This is worldwide, and this is talking about the last few weeks. Let us see the mortality. The mortality rate up until last night, these figures are from yesterday. We have more than 4,300,000 deaths, and the mortality is still in the range of 2.1. In Australia, I leave it to Dr. Emad to talk about it. So I think out of this, it's obvious that the only way to manage this major disaster is vaccination. I should say these numbers here are in spite of having this percentage of vaccination worldwide. We have more than 30% having the one of the doses, and 15.8% have the 2 doses. And that's these vaccination rate, these are mainly in developed countries like Europe and States. And that's why we find the numbers there are decreasing compared with the number elsewhere in the world. Now, a vaccination or vaccine in general are not a new agents or a new medicines. People have it since 1796, and over the last 100 years, we have many of them, and they managed to help human beings by having 14 of the very contagious diseases now classified as a mild disease or sometimes not existing. I haven't seen a new case in poliomyelitis. I haven't seen a single case of measles, for example, for ages. We see old people with the poliomyelitis. So these are vaccines, and these are the vaccination, and this is their history, 100 years of them. And we know about the short-term and long-term side effects of them. And they are still in use. And by the way, out of the vaccination history, there's only one case of a vaccine which was dropped early in the phase because of the side effect. So these are side effects, these are vaccines which we know about very well. Now, I'll stop here a few seconds about the development of vaccines. The anti-vaccine camp talk about the short period of developing these vaccines. They talk about it is 10 months to 12 months, while we know we need years, ranging between 2 and 5 years sometimes, to develop a vaccine, which is true. But this true doesn't take into consideration a very important factor. One and most important one is that the focus right now is only on this virus. There is a focus by all research centers, university on a virus. A lot of research in other aspects of it has been stopped or slowed down, so that we have the focus on this. We have the investment of the globe, of all states invested in this one, and we have the awareness of it there. Any of our medication we use a medication called the Humira in the treatment of a disease called Crohn's disease and ulcerative colitis. What phase 3 number was there? Phase 3 number was 900, probably 40 or 50. Now the phase 3 for those vaccines were in tens of thousands, 30,000, 40,000. To get this number of volunteers to be enrolled in phase 3 is a matter of awareness because of the pandemic. Now, the coronavirus is not a new virus, as we said. It is very closely linked to other family member of the corona viruses in general. And it is estimated that at least 80% of the genetic sequencing, the amino acid sequencing, is similar between our current coronavirus and the coronavirus caused by other pandemics. So the study on them is not new. We have heaps of study on this virus from long time ago, from 2002 and 2012. Now, one of the other things that anti-vax camp concentrating on is the vaccine ingredient. And all of you heard about this talk about special chips, about the use of the placenta, or about the use of tissue from aborted fetuses, etc. In fact, the vaccine ingredients are very well shown. You can find it. You can click on any links to get to all the details about them. All of them, they have just the active ingredient, and I will talk about it soon. And this active ingredient is the substance which trigger our immune system to produce antibody and to stimulate certain immune cells to engulf the virus. They can contain lipids to protect this molecules, and they use salt to balance the acidity of our body, and they contain some sugars which maintain the shape of the molecules against freezing, which is a requirement for storing. This is for Pfizer. For Moderna, it's the same. The mRNA, the active substance, lipid, acid, salt, sugar. These are exactly the only ingredients of the vaccine. Johnson & Johnson, we have the same active ingredient, acid, salt, sugars. AstraZeneca, again, the active ingredient and all the non-medicinal ingredients. And if you can see, there are some salt, water, sugars, etc. So these are the ingredients of the vaccines. Now, we have 4 major groups of the vaccines, and I will pass through quickly. Now, the most recent one is the mRNA vaccine. This is probably the first vaccines manufactured by this method, although this method of using the mRNA used in several infectious immunological and also cancer diseases there. So it's not new, it's in there at least 20 years, but this is the first time used for this purpose. And the whole idea, it is a chemically synthesized piece of the genetic coding outside the body, chemically. It's not related to the virus, not related to the human being. It is synthesized outside. That's why it can't cause corona, like some try to say. It is just a fragment of the genetic coding synthesized, and the idea is to go there to our cells and try to induce antibodies from the body, from our immune system against those spike proteins at the virus. So this is the protein, this is the mRNA, and of their representative, we have the very popular Pfizer. You can look here, the phase 3 patients were 43,000, more than 43,000. The Moderna, which is coming to Australia, it's a member of this group, and it is more than 30,000. Now, the second group depends on using the S protein, using the protein itself. The S protein is the protein of the spikes around the virus, which the virus uses to connect itself to the human body cells through a receptor called ACE2, that to enter the cell, to introduce itself to the cell and then hijack it and control it. Now they use this as an isolated protein itself. So it's not a virus, and it doesn't contain any genetic material apart from this fraction, small fraction of the genetic coding. The representative of this one is the Novavax vaccine, which is an American vaccine. And you can see there are around 30,000 in phase 3. That phase 3 before it is marketed and used. Now, the third group is what we call it a viral vector vaccine. Here, they use a harmless virus, the virus of our cold, common cold, and use it as a vector, as a taxi to drive this fragment of the genetic coding to the human cell. That's all, nothing there. And our body recognizes these viruses. And they depend, the virus used, the common cold virus used, depend on the vaccine. And in this group, we have the Oxford AstraZeneca with the 24 participants in UK only, 24,000. They used the chimpanzees vector in this vaccine. Now, the Indian, in liaison with the Oxford, they have their AstraZeneca version, which is Covishield. So it is AstraZeneca version used developed actually in India using the same virus. Johnson & Johnson, also the American one, also based on this. You can see the number 43,000 used in phase 3. Sputnik, the Russian vaccine, also depend on this technology, and it depends on 2 different viruses, 22,000 in phase 3. The last group is the inactivated vaccine. This group use the killed coronavirus. It is inactivated using this substance called beta propiolactone to carry this fragment of the genetic coding. And this
Dr. Ahmed, just sorry to interrupt. Can we just try to wrap up a little bit, because we have a few more speakers and we really want young people to ask a few questions to you, if you don't mind. So if you don't mind wrapping it up, you would really appreciate it. Thank you so much.
Okay, so there are 3 vaccines here. We have the Sinovac, Sinopharm, Covaxin. Now, to talk about the vaccines, I think a successful vaccine have 2 limbs. One limb is the efficacy. And I wouldn't go back to the phase 3 comparison. I will rely on a recent study with 14,000 from UK, compared the 4 main vaccines. The Pfizer's effectiveness was to prevent 88% of symptomatic cases and between 94 and 96 from hospitalization and ICU. Moderna is the same. AstraZeneca, look at AstraZeneca, please. the efficacy was 70% in preventing symptomatic cases, mild one, but 93% in preventing hospitalization. Very similar to the Pfizer. Johnson & Johnson similar to the AstraZeneca. The second limb is the safety. Is the safety of the vaccine, because the vaccine have high rate of side effect. Obviously, it will be out, and everyone knows there are common mild side effects. But among the serious ones for vaccination, we have the anaphylaxis, very rare, and we have the myocarditis and pericarditis, which we talk about, which occur with Pfizer and Moderna. And you can see here, these illnesses in COVID are much more in number and much more severe. It is usually a mild form of myocarditis. The thrombosis, which is linked to the AstraZeneca, we know the number, 46 in a million, not all of them dead. This is the number of the clots there. And we have our colleague Zainab to talk about it in details. And I think these are the main things. Probably I might talk to some myths of side effects later on in the
maybe we can do it through the question and answers. I think that would be a bit more better. So if it's okay, we would like to move to Dr. Emad.
Okay.
Thank you so much, Dr. Ahmad.
That's all right.
Dr. Ahmad, you're muted.
No, I'm not. So I've just tried to leave, but
you hear me now?
Yes, now you're on.
All right. Good evening to everyone. I will start by acknowledging the organizers, the Arab Council, Australia, the Medical Association, Iraqi Medical Association, and for sure our colleague in MRC, and especially our two moderators, Madam Wafa and Jisman. I would like as well to acknowledge all my colleagues in the panel. And let me, first of all, shout out to the all years 12 students receiving their COVID-19 vaccination this week. Thank you for doing that things. It's great because this is the new generation and this is the youth, and we can start to see exactly what's going on. I will start with a few figures. I will be very brief. The figures I have here, that the total cases since the 25th of January 2020, regarding the cases in New South Wales, is 12,056. At the Australian level, is 37,372. But the problem is with the active cases, which is exceed the 5,000, and the death till yesterday 944, and I heard today is another 2 in Sydney, and I think 1 in somewhere, but this is the final, I mean, like 946. We have in New South Wales at the moment 374 in hospital. In between, 62 in ICU. That means it's really serious. And we have 95 deaths. The other things I would like as well to mention it, that the total doses administered in New South Wales since the 22nd of February 2021 is 4,698 and something. Around Australia now, we exceed the 14 million vaccination. So these figures very interesting and very important. Compare like 2 months ago and what is happening today. The COVID-19 vaccination rollout is the single biggest and most complex inoculation campaign in the nation's history. Each day, thousands of Australians are rolling up their sleeves and getting themselves vaccinated against COVID-19. No matter your age or where you are across the state, you can get your first dose as soon as it becomes available. Use the COVID-19 vaccine eligibility checker to find out when and where you can receive a COVID-19 vaccine, including your second dose. You have a helpline. I always talk about that helpline. If you have any problem, please call 1-800-200-80, and then you can find all your answer to your questions. In fact, Australia has entered into 5 separate agreements to secure more than 195 million doses of COVID-19 vaccines. If they prove to be safe and effective, the Australian government has invested over $5 billion in these 5 agreements, $5 billion. As you know, Australia official policy on vaccines is that they be voluntary, is not compulsory, and free, the vaccine for everyone. What I have to mention here to make sure that people are really safe, that before any vaccines become available in Australia, they must be approved for use in Australia by the 2 organizations, the TGA and the ATIGI. So we have 2 available vaccines, Pfizer and AstraZeneca. Dr. Ahmad mentioned it. Later on, my colleague Joshua, he will talk about it, are already in use in Australia. We have a single dose vaccine made by Johnson & Johnson and has also been approved by the TGA, but has not yet purchased to be used as a part of the national rollout. Now, Monday, we have had the approval for Moderna vaccine, who has been approved by the TGA with, and this is the hope it will work, nothing coming like to wobbling a little bit the rollout. So that approved with 1 million doses due in the second half of September, which will go, and here it's not clear yet, but it will go to the pharmacies first and to the GPs, the first 1 million. The 3 million doses are then scheduled to arrive in each month, October, November, December, and with 15 million booster doses in the first half of next year. So the head of the TGA, Dr. Skerritt, he said that even after 6 months, Moderna was 93% effective against infection, 98% against severe disease, and 100% against death. 2 doses are required. The difference between Moderna and Pfizer, the 2 doses required on 3 weeks time. Moderna, it's on 4 weeks time. So he as well, Moderna, he have 2 doses. Efficacy, high efficacy, I will leave it to my friend Joshua to talk about all this thing about vaccine. And now Moderna, like AstraZeneca is being like manufactured with Oxford, combined Oxford and AstraZeneca, Pfizer between BioNTech and Pfizer. Moderna is a US company, and its vaccine is manufactured in the United States before being shipped around the world. Lonza, which is the combined with Moderna and Lonza, it's a Swiss manufacturer, also produced the Moderna vaccine for European market. Now, how I can get that vaccine? I think we have a lot of information about it at the moment. I will be very brief. You have all to go to the vaccination eligibility checker, and then you register there. They will answer you your eligibility, what time, and all the appointment to be. I will, for the New South Wales government hubs, you can register online. You can as well book with your GP and you fill eligibility form. And as well, you can get your vaccination at your nearest pharmacy. If you go in the Pharmacy Guild of Australia recommends checking their website to see which pharmacy are the participating first and close to you. I will finish by saying before I conclude, I would like really to say a few words regarding what's going on here. We know we are all frustrated. We know everyone is sick of it. Everyone is angry, and we want to stop it, and we want to go back to our normal life. But what we have to do now is recognize the reality of the challenge we have in front of us. To reduce the transmission of the virus, we have really to build trust and social cohesion across all the community and across all our medical advisors and medical team, which we really acknowledge their hard work here. And whatever you are vaccinated or not, please, the best things you can do is stay up to date and continue to be COVID safe, practical behavior. Everyone still, even if it is vaccinated, and you know the vaccine, they don't cover you until the second dosage after 2 weeks to 3 weeks after the second jab. So at that time, you get your 90% of your protection. So stay, practice good hygiene, maintain physical distancing, stay home if you are sick and get tested. And please, please, very important to check in and to check out where you go. It helps a lot. Thank you very much for listening.
Thank you so much, Dr. Ahmad. Really brief, really informative. Thank you so much. Before we continue, we have a few more presentations, but we just wanted to have a little question, a little bit icebreaker session. It's not going to take too long, but we really want you to, put your input. So what we wanted to ask you guys that which country you would like to visit when the border restrictions are lifted, because it's very important to talk about goals. Life is still continuing, right? We still need to make plans, even though it's in a long term. We want your questions. So please write it down in a box, and then let's see where is the destination when the borders are open. And when we see a little bit of the countries, we will then move. Oh, it's already here. Then we will move on to the next speaker. But as I said, it's now even rolled down. Can we just ask the panelists as well, right? When we are getting the countries, then we'll just move on with the
Italy, Morocco, Lebanon, Kuwait, Vietnam.
Yes, coming right. Yes. So, Dr. Emad, which one would you go when the
my first destination, my priority is to go to see Lebanon, my family there. And then second priority, I have got some family in France. So this is the two destination I wish one day to take it and to go there.
Perfect. So mine is definitely would be Turkey. I think I would also prioritize my own home country. Joshua, what about you?
The reason I said Norway was because in March of last year, I was planning on proposing to my now wife under the Northern Lights next to the Arctic Cathedral in northern Norway. And so it's like the place that I just missed out on seeing. So that's just, in terms of restarting life, that's the first place, God willing, we'll go.
Perfect. Dr. Zainab?
I'd love to go to the UAE. That's where my family lives. So really miss them.
Perfect. Dr. Ahmed, what about you?
You're on mute.
You are, yes.
I wrote Iraq.
Iraq, perfect. Nadia?
Definitely my country. I'm homesick. Morocco.
Morocco. Wafa?
I just want to share, Gisem.
Oh, sorry.
Someone in the chat said, I want to go back to my university.
That's right.
Yeah, I'd like to go to Lebanon, that's for sure, that to see my mom, which I haven't seen for 2 years. And that's the saddest part of COVID, unfortunately, and the lockdown.
Definitely.
Yeah.
Yes, so he definitely.
Show us your face. Rachel?
Yes. I wasn't sure. That's why I don't want to put her in a spot, but please.
I know this sounds strange, but I'd just like to go to Canberra to visit family that we have there, somewhere so close yet so far away. So yeah, thank you.
Yeah, thank you so much for the answers. I don't want to keep it too long so that we don't take away from the speaker's time. So yeah, please. I think it's going to be, yeah.
Joshua,
yeah.
Joshua, yeah. Thank you, Joshua.
Thank you so much, everyone. I really enjoyed that icebreaker. It's good to remember that we're all together, that we're all in this, you know, apart but together, and together but apart. So thank you so much to all for the invitation to speak this evening. Yes, my name is Joshua Karras. I hold the position of Executive Manager with the UN Association of Australia here in New South Wales. And I think most pertinently, I am conducting my PhD at the University of New South Wales, looking into tribalism in the vaccine hesitant community. So let me share my screen. I want to, of course, acknowledge the traditional custodians on the land which we meet, all the various lands, and also pay a huge respect to the previous speakers, magnates in their field. Thank you so much for really lifting this. I feel terrible going after such incredible speakers, but I will do my best. Luckily, the topic that I'll be speaking about is quite different, but I think it's very important, especially to young people. The effects of social media on vaccine hesitancy, and then I'll touch on the vaccine rollout. I'll only touch on that briefly. I really want to focus on vaccine hesitancy. So, could be on my way immediately. This is what I'll be speaking about. It'll be no more than 10 minutes, just so you understand. We'll start with vaccine hesitancy, social media, misinformation, and disinformation. They are very different. I will touch on that before finishing it with the current vaccine rollout, etc. So we'll start with vaccine hesitancy. I just want to quickly, we've heard some incredible detailed facts from two doctors in the last hour. I just want to summarize that in a way that that I can understand more succinctly, so to speak. Every year, vaccines save 5 million lives. That's it. Every year, 5 million families don't need to say goodbye to their loved ones. That's enough people to populate the entire city of Sydney every year are saved to vaccines. They are really modern, not so modern day medical miracles and whatnot, which is ironic because I have a fear of needles. So the irony is not lost on me, but studying something that I am afraid of. Yet somehow, despite all of this, we are currently experiencing a pandemic that no vaccine can cure in the same way that these vaccines that have been outlined before are slowly pulling the world out of the COVID-19 pandemic. I'm talking about an unprecedented rise in vaccine hesitancy, which is currently circling the world. People who study vaccines, including myself, are under attack, unfortunately. And what's worse, we're not exactly sure why. Vaccines, according to the SAGE group within the World Health Organization, is defined as a delay in acceptance or refusal of vaccines despite the availability of vaccine services. Simple enough. So I'm just going to quickly move this around. There you go. Of course, my laptop decides to freeze during this time. Effectively, that is the definition. It can be seen as a spectrum, where one end there are those who strongly refuse vaccines, and on the other hand, those who actively seek them. All of us lie somewhere in between that. Okay. So the effect of social media on vaccine hesitancy. So social media has become progressively more primary in our source of information in the recent decade. We more readily process and accept memes, videos, and posts in short bursts, as opposed to long pages of texts, which is what we used to receive our medical information from, or from our GPs. That unfortunately causes a detriment to hesitancy, as we use information from unsubstantiated sources, such as anyone who posts on social media, including people with an agenda to defame vaccines. And unfortunately, they affect our decisions. There's no question about it. It brings us to a paradox that the most accurate information is included within scientific papers, which are incredibly long and complex. As someone, I'm entering my 9th year of university. I'm lucky enough to have 3 master's degrees in public health, and I am struggling to understand what's being said by other scientists about vaccines. So it's something that I feel incredibly strongly about. If scientists can't understand other scientists sometimes, what chance do the general public have in understanding the information that is being released about vaccines? That is one of the reasons why we're here right now, trying to explain exactly what the current findings are from such brilliant doctors that we are in the presence of this evening. So how big of a problem is misinformation on social media and vaccine uptake? Unfortunately, it is now known that it is a big problem. An MIT research group in 2018 found that misinformation spread 6 times faster amongst a test cohort of 1,500 people. It was 20 times slower to reach 10 separate feeds or threads. What that means is, in simple language, when you engage in social media, you like things that react with an algorithm. Every social media outlet uses an algorithm to show you things that you want to see. It is very easy to slip down a particular path where you are shown only certain types of information, and if you like and the algorithm leads you down a path of misinformation, information that is not correct, then unfortunately it is very difficult to see correct information. So that is one of the reasons why it is so dangerous. Let's say an individual at the start of a pandemic doesn't believe in any conspiracy theories regarding COVID-19, but unfortunately, they have severely reduced hours as a result of the pandemic, and they're restricted from leaving their house. A friend of his shares a post claiming that COVID-19 is not as severe as the pandemic is. This person will click on that link, read the information, and the algorithm of that social media outlet will think that this person is interested in that content and begin showing them more and more. It's a very slippery slope. And of course, adding to the emotional frustration of his situation, he becomes intrigued, begins to search, and all of a sudden you have a new conspiracy theorist is born, and we've lost an individual who was at one point listening to scientifically backed information, but is no longer doing that. So you can imagine this is happening on a global scale. Millions of people are engaging in this, and tens of millions of people are engaging in this practice, and it's very dangerous. So currently, I just want to quickly touch on the recommendations. It's been said before, we've got these vaccines that are currently available. Both AstraZeneca and Pfizer being offered at several vaccine hubs. Everything I'm saying right now is straight from the government's website. I'm not making this up. I haven't done my own research. It's just straight from the government website. The easiest way to determine qualification, as been mentioned before, is to book an appointment through the appointment booking system that the government has. And the series of questions guides you through. Both vaccines require 2 doses, as we all know. This information is on the screen for you. It's get it done immediately is what I would recommend. Keep yourself safe. And we now have The side effects, which we all know about, obviously, as has been mentioned before, I won't touch on it very much. We have these potential side effects, and they are extremely rare. Many vaccines that we take without thinking have very similar side effects, including the blood clots and heart inflammation, except because they are not under such a strong spotlight. You know, people take the vaccine and not give it any. It is a spotlight phenomenon from the global media, from governments, from social media outlets that make every little finding absolutely huge. The blood clot finding should not have been a big deal. It happens. Most vaccines have such a scenario in different ways, in different forms, and different statistics. However, it happened in this case. So here are the information. Here's this information simplified as much as possible. The main thing is they have 100% effectiveness. That's huge. That's very important to know. These vaccines will keep you safe in terms of the capacity to stop you being hospitalized. It is true. It is that there is the one in a million. There is the occasional, very rare case where an individual who is double vaccinated, who has received both shots, may still die from COVID. It is possible, but in terms of the scheme of and the parameters by which vaccines are measured, they have 100% effectiveness. So the summary from my end is that vaccine hesitancy is a significant healthcare issue. Misinformation is absolutely rampant and must be addressed, and all COVID vaccines are beneficial. As I mentioned the word tribalism about in my my PhD topic. Tribalism is the concept that an individual will take advice from someone they trust rather than a professional. An individual will listen to their brother or their neighbor and trust that opinion, as opposed to someone who is specialized in the field of the issue that requires an opinion. So the main thing to know about when you speak, a question I'm getting a lot is, how do I speak to someone who's vaccine hesitant? What do I do? What do I say? The answer is, firstly, don't get angry. Don't dismiss them. You must consider that these people have an opinion, a negative opinion about vaccines, not because they are stupid, not because they are ignorant, but because they have had a series of life experiences that have led them to feel this way. As the previous example I gave regarding that individual who lost their job, who clicked on a link at the wrong time at a vulnerable moment, you don't know the story. The main piece is not to judge. Listen to this individual. Hear what they have to say. Then repeat back. It's called empathetic listening. So they may tell you all of their concerns about why they don't want the vaccine. They spout many different scenarios. So you're afraid that the government is lying. You are afraid. You have this concern that the vaccine has not been adequately tested. You have a fear that, in fact, you are being injected with a microchip. I hear you. That must be really scary, and I can imagine how distressed that must be. I can hear that you're very concerned about your own health and the health of your family. Am I right? Is that correct? Open up, demonstrate vulnerability. And you will expect to say, yes, that's what I care about. I'm just concerned about my health. Find some common ground, and you are entering their tribe. That's the main thing. You are engaging in a professional, emotional conversation. You're meeting them at an emotional, not a professional, technical, factual level. That's been proven to not work. You're trying something new now. You're engaging in a conversation that is real, that is human, and that can be impactful. Once you create that bridge of trust, you say, look, I'm the same as you. I am really concerned about my family. And I can see what you mean, how you might think that. It's just that I've been reading about this from this validated source. These people may not know what the scientific method is. Many of you may not know what that is. The scientific method explains, is defined as the process that a scientist undergoes to make sure that they are finding objective truth, nothing more. Where they have a hypothesis, they test the hypothesis as an experiment, and they determine whether or not they were correct. A good experiment will be when something is proven wrong, and the scientist says my hypothesis was incorrect. That is a finding. We have found that this is not true. The main topic, the reason I'm saying that is that when you consider an individual who does not know how the scientific method is rigorous, it's not about opinions or emotion. It's simple fact. If you can explain that concept to them, then you can find yourself being able to explain more effectively why it is important to rely on scientific facts rather than what someone's neighbor thought they read in a Facebook article. So that's just the final thing I want to touch on in relation to how you should communicate. How everything I've just said is referenced, of course. It would be hypocritical of me to say all these things without demonstrating my references. These are my references. As you can see, they're mostly from government websites and scientific papers. So that's thank you for listening. I guess questions, answers now, because then later. I just wanted to quickly include the supplement slide for all those important websites I mentioned. So if you'd like to screenshot that, please feel free to do that. If you
or take a photo of it, right? That's what I do.
Yes, or a photo. That's right.
Perfect. Like, yeah, a few more minutes, then Dr. Zainab will present, and we will quickly go to the question and answer session with Wafa. So
great, thank you.
Yeah, thank you so much, Joshua. Like, even you answered most of the questions that I had for myself that I wanted to tell to my young clients. So yeah, I also have been taking some notes for myself. Yes, please, Dr. Zainab, please continue.
Okay, I'll just start by sharing my screen. Okay, all right. Okay, so for those of you who don't know me, my name is Dr. Zainab Rida. I'm a hematology registrar at Liverpool Hospital, and I'm going to be talking about the very rare blood clotting syndrome that's been associated with the AstraZeneca vaccine called thrombosis with thrombocytopenia syndrome. So I guess what is this TTS? The other name for it is called vaccine-induced thrombotic thrombocytopenia. And just for, I guess, for those of you who don't know, thrombosis is the medical term for clotting, and thrombocytopenia means low platelets. And platelets are essentially the components of the blood that are actually responsible for helping your blood clot. So if you have a cut in your skin, it's the platelets that kind of get together and help you stop bleeding. So this condition, as I said before, it's very rare, okay? And it's a clotting condition that is actually immune mediated. So it's basically triggered by the immune system's response to the COVID vaccine. And what we found is that with patients who develop this, the very few of them, they usually get unusual sites of thrombosis. So a lot of people, we see blood clots all the time in our clinics, but these clots generally would either develop in the leg, okay, and then they might go to the lung, okay, and there's usually specific triggers that we find. So for example, if someone's had surgery, or if they've been on a long haul flight, or for example, if they've been lying in bed, in a hospital bed for several weeks. Basically, we understand that because, as you can imagine, there's less blood flow, and so it tends to kind of congregate together and form a clot. Now, other conditions, for example, pregnancy and also cancer, they tend to make the blood quite sticky, okay? And that's where we see these usual clots that we're very commonly used to in our clinic. Now, with TTS, this is completely different. So basically, as you can see in this diagram that I've got here, the way that it works is that you get the vaccine, okay? And unfortunately, in some people, they form antibodies, okay, against a protein that's on the surface of their platelets, which are, as I said before, responsible for forming clots. And what happens is when all these antibodies and platelets get together, they form blood clots, okay? And so you get clotting, but you also get low platelets because you're using them up. Now, how common is this? And like everyone said before me, this is very, very, very rare. So I've been at Liverpool Hospital for the last couple of months, and we've only seen maybe 2 or 3 cases in our hospital. And that's, you know, in all of Australia, there have been 6.8 million doses of the AstraZeneca vaccine, and only 93 cases have been found. And of those ones, only 57 are actually confirmed and meet the diagnostic criteria that we have established. So I guess you're thinking about on an individual level, what are the risks? So in those who are under 60, we found that the risk, and this is very, this is quite variable because as you can imagine with such a few number of cases, these numbers tend to be less reliable, but they found that maybe 2.7 in 100,000 people could get this under 60. And in those over 60, it's 1.7 per 100,000. Now, I should also stress that once you've had your first vaccine, your first dose, the risk of getting it after the second dose is much, much, much lower. So internationally, the numbers have been 1.9 per million second doses. So I guess, if you put all of this into perspective, comparing it to something like driving, for example, your rate of having a fatal car accident per year is 4.5 per 100,000. So just getting in your car and going out for a drive, you've got a higher risk of getting into a deadly car crash than getting a clot from the vaccine. Moving on, who's at risk for getting this condition? At the moment, we haven't found any established risk factors, so we don't know who's more likely to get it. But based on our limited understanding of how it occurs, there are only 4 very rare conditions that we think should probably not get, people who have these conditions should probably not get the vaccine. So, and specifically the AstraZeneca vaccine. So people with cerebral venous sinus thrombosis, and that's a special type of clot in the brain, not your usual stroke. A condition called heparin-induced thrombocytopenia, a condition called idiopathic splanchnic vein thrombosis, which is a type of clot in the abdomen, the tummy, and antiphospholipid syndrome, another condition that's also quite rare. Of course, a lot of people will be asking, oh, well, I've had a heart attack, or I've had a stroke, or I've had a clot in my leg. Should I get the AstraZeneca vaccine? And the answer is yes, that there is no contraindication because, as I said before, the way that this condition works is completely separate to the usual clots that we see. And then, of course, important thing to know is symptoms. So what we found, especially in Australia, is that when we can pick these conditions up pretty early, okay, because we have quite rigorous testing, and when they're picked up early, we have very effective treatments for them. So what symptoms, can people get if they have this condition? So if you have a blood clot, for example, if it's in the brain, you might have a headache, blurry vision, or seizures. Clots in the lungs, you could have breathlessness, chest pain, clots in the legs, leg swelling, or clots in the tummy, abdominal pain. And of course, if you find unusual skin bruising because of the low platelets. We find that when they do occur, that it's usually between 4 to 42 days after the vaccination. So if you go home after the vaccine and the next day you're feeling a bit off, you've got some muscle aches, you've got a mild headache, it's probably not this, but definitely see your GP if you're concerned. And we know that, as I said before, we've got some established diagnostic criteria, so using blood tests and scans that will help us rule out this condition or rule it in. And as mentioned previously, we've got very effective treatment. So that includes something called intravenous immunoglobulin, which is basically actually giving you antibodies that attack those antibodies that are already there, and then blood thinners or anticoagulants. And that's pretty much it from my perspective. I just wanted to see if anyone had any questions.
Yeah, perfect time, Zainab. Thank you so much. It was time for us to just start the most, I think, anticipated section of our webinar. Wafa and I will be sharing the questions. So first, I think I will be starting from our generic section. And I think we also realized that there are some questions in the chat box. So first, I will start with the first one. I will try to keep the names anonymous if it's okay for everyone. So I will just say like young members, since we are all young, forever young, right? So the question is, I took 2 doses of vaccine. Do we need to take another dose every year? I think that's a very good question. Does anyone, like, I don't know who to ask. So I think whoever feels.
Dr. Ahmad maybe would like to answer that question if someone took another dose every year after this first 2 doses.
Look, from the look of it, the immunity offered by the 2 doses there will last anything between 6 months to 9 months so far. This is the duration of vaccination. And it's unlikely that this will cover a longer period of time. That's why a booster dose will be required. This booster dose will be decided in terms of timing in the view of the response to the second dose and the lasting immunity. So there should be, or there would be, a booster dose like the influenza. Influenza, we have a booster dose every year. Like some other vaccines, they have it there, depending on the time of lasting immunity following the last dose.
Okay, thank you, Dr. Ahmad. Jisem, would you like to continue? I saw a very interesting message from one of our attendees. She said she would like to have a look at Dr. Ahmad's slides, and some other people were asking about Josh's slides, so that was pretty interesting. And she said, some people filled up so many gaps in my knowledge, and I just started teaching us about the different type of vaccines and the effects I wanted to understand. I'll be going to have my vaccine tomorrow, and this is the information I was seeking from tonight's session. So this is a great outcome for us tonight, and we were sure that quite a few people did not have the right medical and scientific information about the vaccine and the making of the vaccine, and obviously everybody has been sort of filled up with this conspiracy theory and then all of these YouTubes. Another person was asking us if you, Dr. Emad and Dr. Joshua and Dr. Ahmad, would appreciate to pass a message to authorities and international health organizations to interfere with social media giants and to be more vigilant in filtering misleading messages and videos. This is easier said than done. However, it was worth investing in modifying algorithms to weed out misinformation. So this is a couple of outcomes came from some of the attendees. Another question, what is the best time to take the first vaccine dose after operation? Another medical question, maybe Dr. Zainab or Dr. Ahmad, Dr. Emad. Has Dr. Ahmad dropped out, or we can't see you?
No, I'm just charging. Just tell me what the question, sorry, Wafa?
What's the best time to take the first vaccine dose after operation?
There is no limitation. It can be taken a few days after the operation. There is no relation between the stress of the surgery and the vaccine. So there's no much. Some people prefer 2 weeks, but there is no evidence for that one. So the time is easy. Few days after the surgery.
Okay. Another person asked about if do I need to, Dr. Emad?
I didn't hear the question.
I think we didn't hear the question.
Oh, sorry, is do I need to do a blood test before I get the vaccine?
No need, but in reality, what they do at the moment as a precaution, we do a PCR test. Should be negative within 72 hours. I mean, like a test doing before they take that jab to make sure he's negative, and then he can go. But no need for any blood test to do it. Let me stress the other answer about the one who asked us if we want to do something. The problem is, in Australia at the moment, just a quick things I'm telling that we fighting against two viruses, two pandemic in reality. The first pandemic is due to that virus. The other pandemic, we call it the info pandemic, which taken people through a lot of things which is really not realistic and something like that. So to talk about that program, well, I wish Joshua, he will help in this, maybe in this case, but what I'm asking people really is to trust on science, to trust on medical advisors, and to keep away a little bit, but all this YouTubes and the things going on, and it's not that time. We need that country, we need our Australian citizen to be back to work and to be back to normal life.
Okay, thank you so much. Some other person asked about which one is better, AstraZeneca or Pfizer? It's always like, you know, the contradiction we probably answered, and all the presentations was about, you know, the efficacy and age related, and speak to your doctor, as everybody said. I think that's probably easy. Also, how long after recovering from COVID can you be vaccinated? Did you hear the question? How long after recovering from COVID can you be vaccinated?
Want me to answer?
Yes, please.
Yeah. Vaccination, or the immunity actually gained by contracting COVID-19, first of all, it is a partial immunity, and secondly, it is of short-lived time. Usually, it is advised that in 6 months after the episode of the COVID-19, consideration for the vaccination should be taken.
Okay, another question: is there a difference between the first and the second jab in volume and the strength? That's an interesting question.
No.
No, there's no difference.
No difference. Yeah. No.
Right. Fair enough. Can someone have the first shot in a hub and the second shot with a GP? I guess you can have it any way you can find.
Sorry, what's the question, Wafa?
Can someone have the first shot in the hub and the second shot with a GP?
It's all the same.
Whenever you can find the vaccine.
Look, Wafa, just really good to mention that one. Especially, we want to highlight the people who's living in the Greater Sydney. If they have had this AstraZeneca before the lockdown and the things, and they should really wait 12 weeks. They can go to the closest center where they vaccinate, and it's really good to be vaccinated between 6 and 8 weeks.
Okay, so now down from 12 weeks to 6 weeks. Is it
especially for the Greater Sydney?
Right, so the Pfizer jab differences is 3 weeks. We need to remind people, it's still 3 weeks now?
It's still 3 weeks, and sometimes they ask, depends of the eligibility. And recently they introduced the ATAGI, that chance to have 6 weeks, but I'm not sure. I think they will introduce it once they introduce for the young people between 12 and 15. Maybe they will make it that period of time. So but at the moment, at the moment, it's 3 weeks.
So the 6 weeks was put as a safe way. However, because due to the availability and the doses that we had in Sydney, my understanding was like, you know, they made it from 3 weeks to 6 weeks. Taking the first dose is always a very, very good idea. Go for it, do your first dose, and then wait for your 3 weeks or 6 weeks, depends on your availability and whatever in the end.
And here, we have to confirm as well for the people, because the people sometimes they think if they get the first jab, they get the full protection. Now, the first jab, when it was the alpha variant or beta variant or something like that, we used to have like from the first jab 53% of protection, and we get the 90% or over when we get the second jab after two weeks to 3 weeks. Actually, now with Delta, I think it's less to get it. So maybe, I don't know, could Dr. Ahmad correct me, maybe around 30% instead 30 or 33%. So here I would like really to remind people that keep your mask because you are not protected, fully protected. So when you get your first jab, keep your mask, keep your social distancing or your physical distancing. Wherever you can't really not go through a lot of things. Now we are staying home, that's fine. But I mean, like when you go to the supermarket or you go somewhere, try always to keep distance because with Delta is really, really, it's very serious.
Sure. Another question says, what are the expected results if there is a young boy who is 19 and a half years old and gets AstraZeneca? What is the degree of protection expected from AstraZeneca and Pfizer with Delta and normal COVID-19?
Can I answer this?
Yes.
Look, the response of the vaccine is across ages, so it's not age dependent. So the response in elderly with their immune system affected by chronic illness is the same as for young people. We're talking about age above 16 because the original studies focused on this age. Now there are some studies ongoing between 12 and 16, but for the age above 16, it is the same response. There is no age-related response. I meant to clarify something about the effectiveness and the safety. Now, the study I mentioned deliberately is about Delta. So the numbers I mentioned, they are not phase 3 for those vaccines. They are all for the current wave of Delta in the United Kingdom. So the efficacy you noticed for Pfizer between 94 and 96, and for AstraZeneca around 93, it is on Delta. It's not on the standard strain. So it's still very strong, unexpectedly. In fact, because of the mutation, I wasn't expecting that, but the study confirmed that it is with the 14. It is not 100%, by the way. We can't have an effectiveness of 100%, even against the serious cases, ICU admission, etc. It is in this range. That's why you see sometimes a vaccinated person admitted. So for the credentiality of us, we can't say the effectiveness is 100%. It is in this range, which is almost 100%. That's why some people who are vaccinated can be admitted to hospital, but these are much rarer than unvaccinated. Yeah.
I need to note that it's 8 o'clock now, and then it's very interesting. I can see a lot of people are engaged with us. If everyone is happy, we can stay another 10 or 15 minutes. I've got so many questions to cover, and I'm not sure if we can cover them all tonight. I really appreciate, the audience, your attentiveness, and then your engagement with us. This is great to hear. That can tell us about, you wanted to know more, your awareness of what's going on. Something for Joshua. Don't see you, Joshua.
Joshua, he left because he's got a meeting at 8 o'clock.
I'm sorry. Okay, so there was a question I noticed for Joshua. Yes?
Wafa, can we direct this request to Nadia and Ozek about extending about 10 minutes there? I prefer to do it in one go now, particularly it will be recorded rather than leave some question for another session. So from my end, I'm happy to stay an extra 10 minutes just to answer most of the questions.
Exactly. Yeah, I think Nadia proposed to be like an extra 10 or 15 minutes. Gisem, you still with us? If your team are happy to stay with us, we are continuing. There is another question to say, is there a known reason why Delta affects younger age groups more, potentially age and immune system development related?
Look, I can answer this. There is no special reason related to the age, but the infectivity of Delta is much higher than the original strain. That's why it affects more people. And within this domain, it can affect young people. So it is not a specific cause related to the age. And by the way, Delta is still affecting ages above 60 in a high number. But the change is in the demograph that the ages between 20 and 49 have much more numbers of COVID-19 compared with the original one. So it is mainly the infectivity of the Delta vaccine.
Highly infectious, yeah, correct. So can you mix vaccines if you have no medical concerns?
Yeah, I think we in the past we talked that vaccine can be mixed.
So if you take one Pfizer and later AstraZeneca or the other way around. So now people who took Pfizer, can they take Moderna, for example, when it's available?
They can, but I tell you, there is no current recommendation based on the supply, not about based on the evidence. The evidence is that the second shot, the second jab of a vaccine is stronger than the same dose with the same vaccine given the first dose. For example, AstraZeneca second dose, when Pfizer is given as a third dose, have much more response compared with AstraZeneca as a second dose for AstraZeneca. So the second dose give more response if the first dose is from a different vaccine. And this is proven by a very good evidence, by studies from Germany and by one study from UK, Germany, and Spain. That is, but up until now, neither the WHO nor the Center of Disease Control nor TGA approving using a different second dose. So it is not approved, which means Moderna might not be involved in this change. In the future, it might be. The booster dose most likely will be a different vaccine.
Right, okay. My mom is 75 and she has cancer. She finished her treatments in May. Can she take the vaccine?
Dr. Zainab can probably, it's very close. Can she hear you?
Yes, actually, so we're recommending that all of so in hematology, we deal with patients with leukemia, lymphoma. We're encouraging most of them, except for a very few who probably wouldn't mount an immune response, to actually get the vaccine, including both, either whichever vaccine is available to them. So I'd recommend that she speaks to her GP to see whether she'd be suitable for the vaccine. Fantastic. But there's no contraindication. Having cancer is not a contraindication. On the contrary, actually, because you're immunosuppressed, you probably benefit from the vaccine.
So the earlier the better. Once you finish treatment and you're okay to stay home, just take your vaccine if you get the chance. That's the message for the immunocompromised patients who have cancer and so on. Yep, thank you.
Wafa,
yes.
Can I add something to Dr. Zainab? Even with cancer and even with diabetes, because the same question is always repeating. I mean, all the people with diabetics or with a problem or something like that, yep. It's much better always to save your life by getting like the vaccine to protect yourself from all this. Thanks.
Correct. That's correct. What about kids aged from 11 to 16 years old and the vaccine? Are there side effects on kids?
Well, we said there is no established study about this age, because all the vaccines were for people between the age of 16 up. So there are ongoing studies now regarding the use of vaccines, particularly Pfizer's, between the age of 12 and 16, but there's no finalized study in this regard. But I think it is a consideration, and the consideration based on a general rule that at the age of 12, you can deal with the person as an adult in terms of the dose and in terms of the vaccine. So responses at the age of 12 is similar to responses at the age of 16 or 18. For us in medicine, the dose at the age of 12 is an adult dose for medicine like antibiotics and other medication. So I think based on this general rule, but as a study with evidence-based in this age group, no, there is no established study yet.
So my relative is 16 years old and he's got asthma from birth. They decided to give him the Pfizer vaccine and he's pretty safe so far. It's been almost 9 months, I can say from my own experience. So if, for example, if we have a child who is asthmatic and really severe asthmatic, isn't it a bit safer to give them the vaccine? Like, you know, do they need to speak to their doctors and consider the vaccination?
I don't think there is any link between asthma or any allergic disorders and the vaccine. The only allergy possible with the vaccine is what we call it the anaphylaxis, which can occur very rarely, you'd say 3 to 5 in each million. This is an extreme allergic reaction. And you might get some skin rash, etc., related to the vaccine. But this doesn't mean that people with allergy of any type are predisposed to have a reaction to the vaccine. No. Okay.
I've heard that Pfizer causes side effects in teenage boys relating to myocarditis. Is evidence regarding this, or is it a myth? And are there any long-term side effects? So the Pfizer and myocarditis.
The Pfizer, that's true. Pfizer and Moderna.
But it came up when, sorry to interrupt you, Doctor, it came up when Moderna came to Australia. So that thing flared up a little bit more, we can notice again.
It is true. Myocarditis and pericarditis are well recognized side effects of the mRNA vaccines, whether Pfizer or Moderna. But in all cases, it is a mild to moderate case. 1. 2, it is a treatable case. 3, COVID can cause myocarditis 8 times number more than these numbers. And it is a severe case of myocarditis causing death sometimes. Sudden death in people with myocarditis can occur in the setting of COVID-19, not the vaccine. The myocarditis related to the vaccine is a mild form of myocarditis, easy to manage and to treat. So that's it. Whether the age is young or not, but we know now it is the Delta is causing more myocarditis and pericarditis in young people. Yeah.
Sure. And a question I think we've answered through the talk, but we want to reinforce the answer to the person who asked the question. Is the vaccine active to all kinds of coronavirus? We said, yeah, it's you answered this through the talk, that it is active to all type of variants. Can the vaccine affect fertility or cause any birth defects? So this is also another talk of the town about fertility and vaccination and all of this. So
yeah. Look, I think this myth came from the fact that the S protein has or recorded to claimed that it has some similarity with some of the proteins of the placenta, etc., but that's never proven. And a recent study confirmed that there is no effect of the vaccine on the oligospermia. In fact, the cohort included people with less sperms, and they followed them up, and they found that they recover normally to a normal level of sperms after a few weeks. So there is no link at all between the vaccines and fertility, whether through sperms or through ova. And this is documented by the TGA and by the CDC. These are the authorities we go for. When we want an opinion, we go to the authority. And this authority based its decision or assessment on the evidence, whatever they have. I don't base it on some chatting or rumors. Someone has this, a friend of mine has this. This is not a way to measure the risk of a vaccine or a medicine. I need to get a large number. That's why for anti-vax campaign, I'm talking to our youth. We need to ask them, whenever they pass something, we need to ask them, do you have evidence? Give us the evidence. Give us the study basing your claim about it. So no relation to fertility at all.
Right, and also about pregnancy. So now it is safe for the pregnant person to take or to have the vaccine. It is now published, the studies about it's safe. It's safe in Australia, I think, as well, so far.
It is.
Yes,
It's,
yes,
yeah.
it is.
Okay, okay.
Yeah, and just I mentioned about pregnancy because a lot of talk about it. We consider a pregnancy as a condition where immunity is suppressed, because the body tries to deal with the fetus not as a foreign body. Otherwise, it will reject the fetus. So there is a drop in the level of immunity of pregnant women, which means COVID will affect her badly if she is not vaccinated. And the vaccine benefit will pass through the placenta to the fetus. So it is a dual benefit. Yep.
WHO recommended, and Australia is recommending now for the people on pregnancy to have vaccine. There's no problem.
Okay.
Yeah, just similar to Wafa, I also have, like, you know, in my community, my friends, they are pregnant and they start to get their vaccination. Their doctors really recommended to get it, and they already booked their vaccination first dose. So yeah, like also personal experience.
They're recommending the Pfizer, by the way. So pregnant women, all pregnant women will have the Pfizer.
The Pfizer. What about the Moderna being of the same? It's not tested.
I think it would be the same, because what apply on Pfizer, it apply on the
Moderna.
Yeah.
Okay. So Jism, do you have anything that I missed in your other Q&A, which I haven't looked at so far? I've got about 8 questions. I think some questions are pretty similar and we probably have answered some of them.
Only I saw one question, like it said that, I don't know if you saw it in the end, the first one was a bit more, I just wanted to be more precise. Why they are...
Sorry, then by the time you find that question, Wafa, are you happy to take an audio from Rami?
I have the question, so shall I ask that one first and we'll continue? Yeah, we will do that one as well. He says, why are they saying the Delta version is more deadlier than it has a mortality rate of 0.84, and the first strain is 1.80% mortality rate? He's asking for the doctor. So I think what he's trying to say that the first version is more deadlier than the Delta version.
Right. Can I answer this?
Yes, please.
Now, if we want to talk about facts, we need to go by the numbers. So in this pandemic, we rely more on areas where the number is huge, like United States or United Kingdom, etc. And the drop in the mortality, in spite of the dominance of the Delta, is related to the vaccination. It's related to the vaccination rather than to anything else, because the number of vaccinated people now in both United Kingdom and the States is increasing, is profoundly increasing. We know now it's more than 70% of them have at least 1 dose, and more around 60% have the 2 doses together.
Yep.
So the vaccinated people are at risk of having the COVID, Delta COVID, but with less serious side complication or with less mortality. So that's the reason. It's not the reason in places like Middle East or Asia. We go there to see when the rate of vaccination is low, to see the rate of mortality. 9.2% was the Lambda mortality in Peru. That's their figures. So it is not. It is more deadly. It's more deadly.
Thank you so much. So there's more protection now. That's the reason. Can we take Rami? So that.
Hi everyone. Can you hear me?
Yes.
Yes.
Thank you for all present. I really enjoyed the talk and the presentation from all of presenters. So my name is Rami. I am a PhD student on 3rd year. So I am who wants to like as soon as possible to go back to my university and to finish my PhD. So the key to do that and to go back to our normal life and work, just get vaccinated people. 2 days ago, I got my first job, and I'm looking forward to my next job. And hopefully everyone can follow me and take this vaccine, which is the key again for all of us to get back to our normal life. So that's my comment. So thank you for this presentation and to clarify to people how important to get this vaccinated. Thank you.
Good on you, Rami, and we'd like a lot more of your aged group or your colleagues or friends or anyone to encourage them to do what you've done. You've done great. Congratulations. Really appreciate that you gave that comment to the community. And obviously you can say, look, you're healthy, you're safe, you're living your life, there's no side effects, and then you've done the right thing. Thank you very much for your contribution. Giselle, any other questions that you like to add? There was a few comments here and there. There was a nice comment that I've seen by someone, and somebody asked, like, thank you, it's been very, very good. I realize you're all very busy people, but if you could run this again in the next 6 weeks, so it would be great. I would be telling everyone to zoom in. So someone from Nadia would have taken the person who asked this. I'm not sure from MRC or some other organization. I noticed there is a lot of engagement. We still have 79 people, which is great, participating. I'm not sure, Giselle, would you like to ask any other interesting?
Yeah, to me, these were the main questions that I have been receiving. And as I said, I felt that there was a line for myself as a youth worker, and I really wanted the professionals to answer these questions. I felt that we touched base. I don't want to take more time of everyone. We will have so yes, Dr. Ahmed.
Can I just have one suggestion or recommendation? I was hoping that Joshua was here, because I thought the problem in younger ages will be more prominent, not because of the infectivity and the seriousness of it there, but also by the fact they can be a source of keeping this spread continuous there. You can't hold young people. So I thought that if we can come with a network, a youth network, maybe started with a Facebook page for youth to continue this campaign in face of the anti-vax camp there. And we can feed this page, we can through the young people, we can feed it with the advice, with the answer of question, etc. So my suggestion, if we can get among our youth, those who are happy to contribute by controlling a page like this one, or by holding smaller webinars within schools, within high schools, and particularly now the vaccine is mandatory among year 12
workers.
And today I had a lot of concerns among their families about the vaccine. So some of them will be reluctant to have it, and they say that.
So Dr. Ahmed, would you like to be contacted if anyone is interested?
Yes, please.
Okay, all right.
You give through you, I'm happy to contact it. We are happy to provide them with all the scientific and the practical data. We are happy to consult anyone, but they need to run it between their network, youth networking. Okay.
I can see some comments about TikTok and Instagram, please. If anyone has any idea or would like to look after this group, maybe contact Dr. Ahmed. If you don't have his contact me. My email is everywhere, nadia@wsmrc.org.au, and I'll leave the facilitator to finish because we have a poll. Please stay with us. We have a poll to fill out. Yeah.
Yeah. Okay. There was one question here. If somebody, he said, if I had Bell's palsy in the past, what is the risk if I'm getting Bell's palsy after receiving Pfizer? I've heard this actually question from quite a few in the community members.
No risk at all. And I tell you what's even more risky. More risky, we have a disorder called Guillain-Barré syndrome, where the body sometimes is paralyzed, and young people that they can have it following viruses. This one is not a contraindication to use the mRNA vaccine. So people with Guillain-Barré, for example, which is much riskier than the facial palsy, is not a contraindication to the vaccine, particularly Pfizer's and Moderna.
Thank you. There's obviously a few more questions. There were similar questions. I couldn't see much more that is different. I have a question myself, if you allow me, give me 1 second to ask you, Dr. Ahmad, Dr. Emad, and Dr. Zainab. I've heard a lot about the long COVID, which quite a few young people actually who have the COVID disease, they think, oh yeah, it's just the flu, it goes and I'm okay after. But unfortunately, the young people who have contracted COVID in the world and probably in Australia, they don't know about the long COVID, which is affecting them and affecting their way of life. It's not an easy thing. Can you tell us a little bit and tell the young people who think like, you know, they are very strong and it's okay, it's just a flu, if they contract COVID disease?
Look, it is more and more recognized complication of COVID-19. This is what they call it, long COVID. And actually it is not, it is not only in younger age, but it is in all ages. This long COVID range between a chronic fatigue syndrome, like what we get it sometime post-viral or post-infection, which might last months and months, up to 6 months there. They feel fatigue, they want to sleep more, there is a drop in their appetite, so there is a feeling of unwellness there. It can affect even memory and focus or attention, what they call it, the brain fog. So they feel they are not as sharp as they used to before this infection. There are problems related to long-term shortness of breath, some shortness of breath. This is, by the way, is COVID-19 in general. I'm not talking about the serious cases, because those serious cases might end with a damage to one of the organs. They might end with a kidney failure when they recover. They might end with some degree of heart damage. So the long COVID is another problem. People should consider it when they hesitate going to have the vaccine. While there is no established long-term side effect for the vaccine itself. And the reason why is the vaccine ingredient and content are excreted from the body within days. So there's nothing in the vaccine which stay in the body to cause long-term side effects of complication. There's nothing. The body gets rid of it like any proteins or any salt or any sugars the human being can have. So there's no established long-term effect. We don't have long-term side effect with the poliomyelitis vaccine. We don't have a long-term side effect with the influenza. Okay, so I think this is very important thing to note.
Thank you very much, Dr. Ahmad. Thank you all for all of the information. Jism, if you're there, if you think we've missed anything or...
Yeah, I feel like we touched base most of the issues. What I'm feeling here that I think we're going to have either a follow-up or like a second session, hopefully, with all the, like participants. So that's why I think we need to continue this information sessions, especially like addressing the youth. It is really important, I think, to do so. So as Nadia mentioned, please, fill the, complete the, poll that will be end of the session. But I would like to thank all the panelists for, taking part and doing all this information, providing the information. It's really valuable, it's really crucial. But at the same time, with the organizers like Nadia and Rachel, they had like real huge impact on it. And especially to the audience, thank you so much. We even passed the time. You arranged from your busy schedule and taking part. But I feel like it's really important to do this kind of. I have been doing in a very small setups, but hopefully this will continue in this scale, in the big scale. Thank you so much, and thanks for taking part for it.
Thank you.
I would like to thank all of you as well for giving us the time and the effort. This is a great effort by all of you, and you guys working out of hours to stay here with us tonight, like you're working behind the scenes, all the MRC people. Thank you all to all the audience who participated, and we hope we gave you some insight into the vaccination and awareness. And as everybody said, like, you know, these experts are extremely busy. I don't know if for all of the doctors with us tonight is 24 hours enough for you in the day. Maybe we need to extend the day to be 28 or 30 hours to fill up all your time. And that's really, really helpful. We would appreciate all of your time and your effort. I really thank all of you. Thank to all the audience, to all the questions, the engagement that you presented, the awareness that you wanted to know. We are here and we are there for you. Ask the questions, please. We want to be safe.
If you allow me, Wafa, we saw some comments in the chat about what about an Arabic session. I would like to advise that we did an Arabic session with Dr. Ahmad Alrubaie, Dr. Emad, and it's on the YouTube channel, the Western Sydney MRC YouTube channel, and also in our Facebook. You just look at the Facebook, you will find the live there. And also I would like to thank Dr. Zainab and Dr. Ahmad, Dr. Emad, and then Joshua as well, Wafa, on behalf of Western Sydney MRC, and also on behalf of the CEO, Kamal Debouzi. He just sent me a message. He would like to thank you for your time and thank you for tonight's session. I can still say that some people, they filling out the poll. Maybe we can stop the live stream on Facebook and then just leave this session for the attendees that they're filling out the poll, if that's okay.
Thank you very much for having us.
Thanks, Sue. Thanks all.